Right here we have our parietal pericardium, the outside covering of our heart. What lies tight against our heart would be the visceral pericardium. The very top half where our vessels enter into the heart would be the base of the heart. Down here at the bottom, we have the apex of the heart. We have our right auricle, our left auricle, the right atrium, right ventricle, left ventricle. The indentation here is the interventricular sulcus. What also runs along there would be the coronary artery. Looking up here at the base of our heart at the vessels, we have our pulmonary artery, we have the aorta, we also have the brachiocephalic that comes off of the aorta, and what connects the aorta and the pulmonary artery together would be the ligamentum arteriosum. Going around to the backside of our heart, we can see the superior vena cava and our inferior vena cava. If we look here, this would be the right side of our heart, so we're going to go into the right side. Look at the right atrium. Inside the right atrium, we can see the pectinate muscle, this bumpy stuff right here, going down in between the atrium and our ventricle. We then can see the cuspid material. This would be where our tricuspid is contained. And then you can also see the cords here, the little white strings. These are the chordae tendineae connected to the papillary muscle. Here's another chordae tendineae here, connected by the papillary muscle. This band right here is called the moderator band. And then the bumpy stuff around in here in the ventricle is called the trabeculae carneae. Along this side, we also find the septum of the heart that helps to separate the left and right halves of the heart. Going over here to the other side of our heart, which would be the left side, we find, again, the left atrium with the pectinate muscle. Some very nice, here's a nice display of the chordae tendineae connected to our bicuspid valve, and then our papillary muscle here with some more trabeculae carneae down in through here. Right outside here, we also can see the opening to our veins, the pulmonary vein. Now, going up through here, we are going to look at our pulmonary artery. With the pulmonary artery, you can see these little pocket valves right here. Those are the semilunar, the pulmonary semilunar valves. And if we go in through this way to our aorta, you can also see the aortic semilunar valves here. Now, also here in the aorta, we can see a little hole right here. That would be the opening to our brachiocephalic. And then if we stretch this out a little bit, you can see a little hole right down inside here above the valves, the semilunars in here. And that would be the opening to the coronary sinus.